Hello, I am Dr. James Monath, a partner in the practice of the Center for Urologic Care of Berks County in Reading, Pennsylvania. I have been in practice for over 25 years after serving as an active duty urologist in the Air Force following completion of my residency at Wake Forest University Medical Center in North Carolina. Today, we are going to be talking about bladder control issues. Unfortunately, almost half of people who have bladder control issues are embarrassed to talk about them. Being embarrassed to talk about these problems prevents many people from getting the help that they need and deserve. We are here today to end that pattern and teach you how we help patients at our practice get the relief that they need. Here's what we'll be talking about. Understanding bladder control, which will be an overview of how the bladder works and some of the problems that can occur. The care pathway that will show the progression of your treatment. And we will also discuss all treatment options in detail, particularly Medtronic bladder control therapies, which cover 2 proven and effective options. Then we'll wrap up by answering some common questions. Most people do not realize how common it is to have overactive bladder, or more commonly termed OAB for short. It's actually more prevalent than vision problems and diabetes, 2 conditions most people think of as being extremely common. Many people with OAB self-manage by drinking less, wearing pads, and restricting their social activities. At the same time, many physicians don't realize how embarrassing it is for patients to talk about their bladder control problems. So we physicians don't ask, and patients never bring it up, and it remains undiagnosed and untreated. Like vision problems, bladder control issues can happen to men and women of any age. Although your risk increases as you get older, that doesn't make it a normal part of aging. It's not something that you should accept or ignore or leave untreated. Doing so can raise serious risks for your self-esteem, confidence, and your overall general health. It's really important to note that incontinence is not a normal part of aging or something you just have to live with. It's a serious health issue. I'm sure the descriptions on this slide will sound very familiar to many of you. The bottom line is, OAB can be a very embarrassing condition, and it can have a significant impact on your quality of life. It may prevent you from going places or doing things that you like because you are fearful of an accident. You're always looking for that next restroom, and you're making frequent trips to the restroom throughout the day to try to prevent any accidents. To understand what your body is saying, it's important to know that communication is critical to how the bladder works. Bladder function involves the coordination of the brain and the muscles of the bladder through nerve signals. As your bladder fills with urine, nerves tell your brain that it needs to empty. Research suggests that bladder control problems are linked to poor bladder-brain communications. For example, if you go frequently, your bladder may be sending signals to your brain too often. If you have urgent needs to get to the bathroom and end up leaking, it could be because your bladder is sending the signal too late. There are therapies available that we will talk about throughout this presentation that can correct the communication so the correct signaling does occur. So where do communication problems come from? There are many potential causes. Some are as simple as what we eat and drink every day, or the medicines that we take. Some are related to life events like childbirth and health conditions. You may have also injured your pelvic floor at some point in your life. In general, there are 3 common bladder control problems that are listed on this slide. In the next several slides, we will discuss each one of them. What is stress incontinence? Stress incontinence relates more to familiar physical activities. It occurs when there is an increased pressure on the bladder as a result of a cough or a sneeze, or with activities such as lifting or bending that results in a sudden loss of urine. Stress incontinence is typically due to weakened or damaged pelvic floor muscles. This type of incontinence sometimes requires surgical correction. Some people have a mix of both stress incontinence and overactive bladder or urge incontinence. What is urinary retention? Urinary retention happens when you can't empty your bladder adequately, often because you can't tell if your bladder is even full. This can be incredibly frustrating and may also require the use of a catheter to empty your bladder. It may or may not be caused by a physical obstruction, so you may have obstructive or non-obstructive urinary retention. OAB is defined by the following symptoms. Urge incontinence is the sudden urge to go to the bathroom, which then results in the actual loss of urine. Frequency means numerous trips to the bathroom, as well as a constant urge to urinate that often leads to leakage. If you have OAB, you may have a variety of overlapping symptoms. Our goal is to work through all of your symptoms and to help you find a therapy that fits your individual needs. Right now, we are going to focus on overactive bladder. The good news is OAB is a treatable condition. Diagnosis, lifestyle changes, oral medications, and advanced therapies are potential steps involved in finding the best treatment for you. We'll take a look at each one sequentially. Remember that every person is unique, and what works for someone else may not be right for you. The first thing to try is often simple lifestyle changes. In other words, these are behaviors that can help your situation. It might mean changing what you eat and drink, decreasing your caffeine intake, or getting more exercise. It might involve bladder retraining, such as delaying going to the bathroom or sticking to a bathroom schedule. Pelvic floor strengthening is also very important and can be done by repeatedly contracting and relaxing the muscles of the pelvic floor, commonly known as Kegel exercises. These are things that many people with OAB are probably already doing. In some cases, these lifestyle changes may not work very well or at all. When lifestyle changes fail to deliver the results you want, oral medications are often the next step. These medications work on the bladder muscles and not the nerves. They can help control symptoms, but they do have some drawbacks. You have to remember to take them every day. The side effects can be unpleasant, such as dry mouth, blurry vision, constipation, and high blood pressure, and they don't always work. This may be why in one survey, 72% of people said they stopped taking their medication after 6 months. One last point. For some patients, OAB medication causes some confusion and memory loss. In fact, A recent large study funded by the National Institute of Aging and published in the Journal of the American Medical Association showed that elderly people taking anticholinergic medications are at a greater risk for developing dementia. If conservative treatments don't work for you, there are advanced therapies available. Medtronic offers 2 of those therapies, and the third is an injected medication. Let's go over some of the trade-offs involved with each of these options. Injected medications treat OAB temporarily and require multiple ongoing office visits and usually some type of anesthesia for each treatment procedure. Just like oral medications, injected medications focus on the bladder muscles and not on the nerves. Medicine is injected directly into the bladder muscle to partially paralyze it. That is why this treatment does not address the bladder-brain communication pathway we talked about earlier. If you use injections, you may be more susceptible to urinary tract infections and end up having to catheterize yourself for a period of time afterwards. The Medtronic Neurosystem, commonly referred to as PTNM or PTNS, is another type of advanced therapy. Here's how this therapy works. It stimulates the tibial nerve, which is located just above your ankle. This nerve then communicates with the nerves to the bladder. The goal is to restore bladder function, achieving a noticeable reduction in your OAB symptoms. Each treatment session lasts 30 minutes and takes place in the office. It starts with 12 weekly sessions and then moves on to monthly maintenance sessions afterwards. A key point is that most insurance companies have a strict 3-year limit on this type of therapy. Medtronic Sacral Neuromodulation, or SNM, uses the Interstim system. This therapy is the most effective at correcting the communication issue between the brain and the bladder. It provides relief and can restore bladder function by gently stimulating the sacral nerves, which corrects how signals are sent between the brain and the bladder. It will calm the bladder down if frequency is your issue, and if your problem is urgency and incontinence, this therapy can fix the signals so you are notified sooner in order to prevent urine leakage. Here we see the proven results. 84% of people are satisfied and report a 3 times or greater improvement in quality of life with this therapy. This is very important data, especially in comparison to oral and injected medications that we looked at previously. In fact, SNM is the only therapy that provides better relief than medications. This therapy is also very effective for those individuals who suffer from the type of urinary retention we mentioned previously, that of the non-obstructive variety. The best part about this therapy is that there is a test that allows you to try the therapy and see if it works before you and your doctor decide to go ahead with it. Again, unlike other advanced treatments, this therapy lets you try it first. It's like a test run, not a long-term commitment. At the end of the test, you'll have a much better idea if this therapy is going to deliver the relief you want and expect for the long term. So what makes someone a good candidate for this therapy? If you have significant symptoms of OAB, especially urge incontinence or severe urgency and frequency, and you have already tried different kinds of lifestyle changes and oral medications, without getting the kind of relief that you want or need to get back to living life the way you want, or if you have the non-obstructed variety of urinary retention, you may be a good candidate for this type of therapy. A great place to go for more information, besides our office, of course, is the Medtronic YouTube channel and the Medtronic website. There you can find many patient success stories on the YouTube channel. And if you visit the Medtronic website, you can find an ambassador that will call you to talk about what it has been like for he or she living with this therapy. So what happens next? Please contact our office to help you schedule a follow-up appointment so you and I can talk one-on-one. We also invite you to email us to request more information. And now we will take some time to answer some common questions. How long does the relief last? SNM has been shown to be effective for up to 5 years, but your experience may be different. Will it cure my condition? It can provide very effective relief, but it's not a cure. What does the stimulation feel like? Most people describe it as a slight pulling, tingling, or fluttering sensation. Will insurance cover the costs? Medicare and many private insurance companies cover this therapy. Can I have an MRI? Yes, you can have a full body MRI scan under specific conditions. You and your doctor can discuss further safety information in this regard. In addition to risks related to surgery, complications can include pain at the implant site, new pain, infection, lead wire movement or migration, device problems, undesirable changes in urinary or bowel function, and uncomfortable stimulation that is sometimes described as a jolting or shocking feeling. Talk with your doctor about ways to minimize these risks. And thank you for your time and attention to our presentation.